So, good evening. Welcome to another Rare Talk from ORDI. I am Benita, and on behalf of the entire team, I welcome Dr. Radha Rama Devi, ma'am, who is our guest speaker today. She has over 40 years of practice in clinical pediatrics and research in medical genetics. She also played an instrumental role in setting up the first newborn screening in India. And September being the Newborn Screening Awareness Month, we are more than privileged to be able to talk to you today, ma'am. So we welcome you.
Thank you very much.
Yes, ma'am. So just to start it all off, what was your driving force behind starting this newborn screening in India, ma'am?
Well, going back to my student days, that was my passion as a postgraduate student in pediatrics. My professor's advice was that if you are a pediatrician and you have to prevent at least one child from becoming mentally retarded. So that was the uh, push and initiative which my professor had given. And this led to uh, think about how I can do this. So I was reading some books on preventable causes of mental retardation way back in 70s. And at that time, Professor Robert Guthrie has introduced the newborn screening in the United States. And so I wished whether I would be able to do this uh, to our babies in India. So that was my passion to start the screening. And this has come into um, existence when I met Professor Alan Beatles when I was working at the Institute of Science, Bangalore. So there we had a meeting, and he's a scientist from King's College, London. And he also had a similar interest to start screening in India. But it was a Herculean task at those days because nobody heard about newborn screening in India at that time. So when we started the screening, I was ridiculed. I want to put that word first. Ridiculed by my own colleagues. And then they said that you are far ahead and we don't need this screening in this country. So that was the uh, maybe I can say that may be probably it is a negative comment, but that has given me a strength to say why can't I do it? So we did it, and we screened 125,000 newborns in Bangalore, and that was the first screening in India. So that was my initiation, and this we took it forward when I joined the in charge of the diagnostic division at Center for DNA Fingerprinting at Hyderabad. So at that time, we had a very good funding coming from Dr. Reddy's Labs. Dr. Anjireddy was the chairman at the time, and he had given me a good funding to start the extended program of newborn screening. And that has helped me to do a large scale screening again in Hyderabad, and we published those results. And afterwards, you know that the ICMR has taken interest and people got interested in newborn screening, and now it is just going on. And I can say I'm so happy that at least now people accepted it and doing it in some of the states such as Kerala and Tamil Nadu and Chandigarh, Delhi. So many places the newborn screening has been going on, at least for one disorder. And also we have developed the expertise in testing the babies. But no, only the future is we need to include more disorders to test these babies and also see that it reaches each and every baby that is born in this country.
Wow, mom, that's amazing. And like you said, it is definitely one of the biggest public health achievements in our country. And we have to congratulate you for the efforts that you have taken to allow this to happen, ma'am. So, like looking back in the epidemiological perspective, how would you say that the infant mortality rates have reduced, ma'am, over the years because of the entry of newborn screening?
Well, it's a very difficult question to answer. But according to, I mean, the WHO has decided to end the preventable causes of deaths in the newborns and under 5 by 2030. So,
Okay.
so we hope that the screening is helping to reduce the infant mortality. But I cannot give the figures how much it has done in this country because we have not done a universal newborn screening in this country to say that it is. But when we look at the babies who are already affected by the disorder and present with acute illness, and when we screened these babies, we found a high prevalence of inborn errors of metabolism to the extent of 4% of the sick babies, they have a metabolic disorder. So that means we have a very high prevalence. So when we looked into, recently we looked into about 6,000 newborns, we found every 2,000 newborns, there is one baby affected with one or the other type of an inborn error of metabolism. So our prevalence is, I'm sure, is high, especially in South India, where there is a huge amount of consanguinity. So we do expect a high prevalence of these disorders once we start doing on a universal newborn screening program.
Okay, ma'am. Yeah. So when the newborn screening happens and there is a particular diagnosis for a few families, how do they react, ma'am? Like, because there's more awareness now compared to say 20, 30 years back, do you think that the stigma has reduced and people are more willing to come forward to have their baby screened, ma'am?
Yeah, actually, there are two things. The individuals, when you say, we divide them into three groups about the acceptance of newborn screening in this country. That is, the first group is the medical profession, and the second group is the public, and the third group is the politicians. So, so when we say this medical profession, still they really don't believe in newborn screening because they say that this is still not a priority area in this country.
Okay.
But I'm sure in future, once we are reducing the mortality due to common causes such as infections, diarrhea, and malnutrition, non-communicable diseases such as inborn errors will definitely show up. And I'm sure it is already showing up. And so compared to the previous years, to the present situation, there is some amount of awareness is coming among the medical profession also. As we see, number of private nursing homes also carrying out newborn screening. So that is one. The second is the public. A public definitely will accept if you tell them the benefits of newborn screening. And because many a time I hear the parents telling me that if you were told that there is a screening like this, we would have definitely got it done in our newborn baby. So the awareness is not created in the minds of the parents by the medical. So the awareness has to be created starting from the antenatal period when the lady goes to the obstetrician. They should be giving advice to the couple that a newborn screening is essential. And I'm sure if you tell them properly, all of them will agree for newborn screening. The third is the politicians. Say how much you do, unless there is a will from the politicians to see that this is implemented, this will not happen. So if you have somebody who can help us to see that the screening has to be done in this country from a politician, I'm sure this program will take up very well, just like what we are doing for the immunization. So these are the aspects that we should keep it in mind about the dilemmas and whatever you are asking with regard to newborns.
Okay, ma'am. Ma'am, also, how would you think that organizations like our Organization for Rare Diseases India play a role in this mission, ma'am?
Yes, you have to get it, take it to the higher ups and make
Okay.
them understand the importance of screening.
Mm-hmm.
See, government has introduced certain schemes,
Yes.
but unfortunately, they're not very clear as to which program has to be done. Say, for example, the government has a national health mission under
Mm-hmm.
which there are so many schemes that have come up, such as the newborn baby screening is also included in that. But it has not been made popular, and nobody is utilizing that money that is given for that. So these
Mm-hmm.
are the things they should start using that money in each state and see that the screening is implemented. So this is what the organizations should go and pressurize or even make them aware about the the availability of funds as well as the importance of the screening at that level. If that level says okay, then
Mm-hmm.
immediately this will be implemented in this country. Not that the country doesn't have money, we have money because we
Mm-hmm.
see many of these benefits that are being given. Say, for example, a pregnant lady gets 6,000 rupees for every pregnancy from the Prime Minister's Yojana funding.
Mm-hmm.
What is it that is that money going to that pregnant lady? I'm sure it is going to her husband for drinking. Instead of that, if you start doing screening for 2,000 rupees,
Mm-hmm.
the whole newborn screening can be done.
Yes.
So this is the thing that we should make them aware that
Okay.
such a thing can be done from that money which is given to the pregnant lady. In some
Mm-hmm.
states, they give kits to the delivered mother. And what does it contain? A frock and a bed sheet and powder and toys. What is the use of those things?
Mm-hmm.
Instead, if they put that money in screening the babies, this is going to help them in a long way. So this is
Mm-hmm.
what I want the organizers to tell to the politicians, that this has to be done under these programs.
Yes, ma'am, I agree because, like, since you brought up the health mission and the health budget of our country, definitely there is a lot of awareness on more communicable diseases and non-communicable diseases like cancer, for an example, where a lot of the spotlight is shown, whereas other NCDs have not been given proper funding due to lack of awareness. That is definitely one major factor, ma'am.
Right.
And yeah, like you said, like even for the screening, for the people who can't afford it also, they should be able to have access to such facilities.
Yes.
Yes. Can you give more insight on the whole process of the newborn screening, ma'am, like the steps that are involved?
Yes, the newborn screening consists of testing every baby born,
Mm-hmm.
irrespective. It is, every baby who is born should be
Mm-hmm.
screened. That is it. And the screening has to be done usually on the third or the fourth day after birth.
Okay.
That means the baby should be given at least 3 to 4 feeds before the test is done, because the child needs to be exposed to the milk and the
Mm-hmm.
proteins, carbohydrates, and fats. And in these 3 days, we'll know how the metabolism takes place in the baby. And if there is any deficiency, then it will show up. Suppose you do the testing without giving milk, then sometimes you may get false negative results. So that's why
Okay.
we need to feed the baby before the test is done. So
Mm-hmm.
usually this is done after 3 days after birth, or it can be done, suppose if it is not done on the third day, it can be done any other day, but before before 28 days, because you should not lose
Yeah.
time.
Mm-hmm.
Okay,
Yes.
so as early as possible, and after the third day, then the test has to be done in a full term child. But if it is a premature child, premature baby, low, then you may have to wait for 2 weeks before you do the test. So this is the way newborn screening is done, and the test results should be available within 72 hours, because in case if the baby is affected, then we need to start the baby on treatment and prevent acute crisis in those babies. So early treatment, early intervention is very, very essential. And if you do this early intervention, then you can bring down the morbidity, you can bring down the mortality, and you can give full normal life to the child. So this is the protocol that you need to follow.
Okay. Yeah. And regarding the professions involved in newborn screening, like when at a first glance people think that only the primary physicians are involved in this whole cycle, but when reading through, I found out that it was a very interconnected field and a lot of people were involved from different professions of science. So can you maybe give a bit of insight into that, ma'am?
Yes, actually, it's not a single person who does the newborn screening. It is a total community. Say, like taking the baby as a central theme, you have the nurse. I start with the obstetrician to give antenatal advice to the couple. Then the neonatologist is very, very important to see that the newborn screening is done. And the nurse who takes the blood properly, that the sample has to be collected. Then you have the counselor. Then you have a transport mechanism where you have to send the sample to the lab for testing. Then you have to receive the results, and it has to be recorded and then given back to the patient in the form of a report. And then counseling has to be done once the report comes, whether the report is normal or abnormal. So if it is abnormal, then the baby goes to the particular specialist. It could be a metabolic specialist if the child has a metabolic disorder. It could be an endocrinologist if it is an endocrine problem. So depending on the type of the disease, the child has to be seen by a specialist, and then the treatment has to be advised. So it's a multi-speciality group, and involving the public, you have everything. You have to be included in the newborn screening. It's a total process.
Yeah, I agree, ma'am. It's definitely a multi-sectoral approach coming to newborn screening. And just going back to one of the points that you'd earlier mentioned at the beginning about how there was a lot of incidents of inborn errors of metabolism in the newborns that were screened. What would you say are the possible causes for that, ma'am?
Most of these inborn errors are genetic disorders, and these genetic disorders occur when parents are carriers for the disease. Carriers means they will be carrying one abnormal gene, they have another normal gene, and both the parents. And if the baby gets both the abnormal genes, then the child will be affected with the disease. So this is the basis of the occurrence of a inherited metabolic disease.
Okay.
Occasionally, you can get, even when the parents are not carriers, the child can get the disease by what is called a de novo mutations that occur in the gene. So you can get that, but it is unusual to get a de novo mutation in a recessive disease, but you can expect that. But mostly recessive disorders, the parents will be carriers. That's why I said the close marriages increases the prevalence of these diseases, because the first cousins, they share genes quite often than when they are not related. So the relationship brings in the closeness of these genes, and so you get a higher prevalence in inbred or closely related marriages. So these are the causes for the disease.
Okay, yeah. So where do you see the future of newborn screening in India at, ma'am? Say in like 5 to 10 years, what would you say are the goals to be achieved in this field?
Well, what I saw previously and what I am seeing now, we have come from a negative level
Yes.
to, I can say, just at the positive level.
Yes,
So
ma'am,
at least
definitely.
we have moved forward.
Yes.
And some places people are doing screening, but definitely in future it's going to improve. This is my hope, and also I wish that it should be done so that every baby will be benefited.
Yes, ma'am, definitely. And would you do you have any tips for the young medical professionals today, ma'am?
Yes, you see, they should take more interest in these conditions, and not only just treating the common ailments, which anybody can treat, but if you can start treating a special child, then it is worth their degrees. That's what I repeat what my professor told me,
Yes.
that they need to do this so that they should bring a smile on the face of the parents as well as smile on the face of the affected child. If they can do that, it is worth earning lakhs of rupees. So they should take interest and don't give negative counseling to the families when they find a child with a metabolic disorder or an inborn error, saying nothing can be done, your baby will die. Such a type of talk should never be done. Encourage them and see what best can be done to the child, and try to make the child as comfortable as possible.
Yeah. I agree, ma'am. And like you mentioned, this empathy component in newborn screening definitely plays a vital role in the whole process. So I think that covers everything, ma'am, whatever I had in mind. And you clearly put forth all your thoughts and how the story of how it all began, which was very inspiring for me, especially. And it's amazing, ma'am, to just see the whole journey from your point of view and to see where it can be in a couple of years in our country.
Right.
Yes, ma'am. So
Thank you.
I, on behalf of ORDI team, would like to thank you for spending your time with us, ma'am. It really means a lot to us, and we we are very grateful that you allowed us to have this conversation.
Thank you very much. And I wish that newborn screening will go up step by step
Yes,
to
ma'am.
reach the full screening in future.
Yes, ma'am. We're all going to follow your footsteps in that, ma'am.
Thank
Thank you. Thank you,
you.
ma'am.
Okay.